I was just getting a routine, my annual physical, and I noticed that there was a bump on my chest that I had my physician take a look at. At that point, she recommended that I go to imaging to get it checked out and have an ultrasound. When they made the appointment, it was for an ultrasound. When I arrived, they said, we're doing a mammogram. And so I'm like, that's not really what I came for. But ultimately, they did the mammogram. And then in that same day, they had to go back and do the ultrasound anyway. So I got all the full meal deal. Now, 6 months prior, my niece was diagnosed with breast cancer while she was pregnant. And so as a family, we bonded together to support her and all that. So of course I did have concerns right off, but I tried to tell myself it's nothing, won't be a big deal. So shortly after my imaging results, I was called by Baylor Scott and White, one of the nurses, to schedule a biopsy. It was tough at first, to have them let you know, hey, this is cancerous and we need to do something about it. My initial reaction to it being breast cancer was pretty much, I've never known any man with breast cancer. So it's like I hit the wrong lotto. And, breast cancer, wow. So I found out that it was a real thing. It does occur. Facing the reality of it was one of the tougher times in the whole situation for me because I didn't know what was next. I finally came to Baylor and I had a sit down and meet with the doctor, my wife and I. That is when the whole thing was kind of broken down to me. And she did a great job of explaining exactly where I was at. And after that, I was actually given options of how I want to proceed with my care going forward. I chose to go the double mastectomy route because it was such a lower rate of return for the cancer. And the last thing I wanted to do was come back and go through it again. And once the tumor was removed, they sent the tumor off to be tested. And an interesting thing is that my breast cancer results came back exactly like my niece's. Because of the test results, chemotherapy was recommended that I would have to go through some treatments. And once again, I said, okay, and my wife boo-hooed. Made an appointment to have a port inserted. That is how they administer the chemotherapy. Final outcome for me was to be able to ring the bell. I fought really hard to get to that point. And really my inspiration for that was my niece that I spoke about earlier. She actually had a single mastectomy while pregnant. She had a healthy baby boy, and she proceeded and completed all of her treatment and was able to ring the bell. And she's doing great. She just laid the foundation for how to go through something like this, and it's made me a stronger person. Breast cancer, for me, it's had not only a negative effect in a sense, but a positive effect on my life. And I say that because you don't realize sometimes the support that you have until you need it. My support staff, or team as I call them, unreplaceable. Did everything mentally and physically that they could for me when I needed them. I have a beautiful wife, 2 beautiful kids, and a huge family that loves me and I love them. So at this point, a year later, I am 100% sure that Baylor Scott and White was the best solution for me. It was the best care that I could have chosen throughout this process. I came to the right place. I've met some great people, some people that have impacted my life, and I hope that I may have made them smile once or twice during my time here too.
Wow. Good evening. I am Patricia Watkins Lattimore, CEO of the Delta Research and Educational Foundation, known as DREF. Welcome to this evening's webinar entitled My Point of View, Breast Cancer from a Unique Perspective. Partnering with Delta Sigma Theta Sorority Incorporated and the National Council of Negro Women for the 4th year, DREF is one of 5 national community engagement partners for the All of Us research program from the National Institutes of Health. This project and initiative was started under President Barack Obama. DREF with Delta Sigma Theta and NCNW is actively seeking 1 million or more people from the African American communities to help speed up medical research. We aim to make precision medicine available for all of us. At the moment, healthcare is often one size fits all. DREF imagines a future where your healthcare is tailored to you, and we want to make that future possible by creating a resource that allows researchers to conduct thousands of studies on health and disease for treatments that are tailored to us. Prior to March 2020, DREF conducted outreach in various venues across the country that were attended by the African American community. Our pandemic pivot has been to totally digital presentations shaped around topics of interest to our communities. Tonight's presentation, as part of Breast Cancer Awareness Month, focuses on male breast cancer because men are not immune. Tonight's webinar brings you an insightful dialogue with Matthew Knowles discussing the topic of men's health and wellness to include breast cancer awareness, early detection, and being a survivor. Our moderators for this candid dialogue to highlight a very important but often neglected topic are Harry Johnson and James Staten Jr., co-chairs of NCNW Charles L. Franklin Men's Assembly. Also joining our dialogue will be Terrence Shirley, administrator of the Cancer Institute, University of Mississippi Medical Center. He will share his perspective on the importance of research, testing, and treatment. Dr. Maria Dixon, a research scientist, will guide us through the wrap-up and closeout for tonight's session. And now our moderators, formative co-chairs of NCNW's Charles L. Franklin Male Assembly. Harry E. Johnson is a career lawyer, entrepreneur, public servant, and a partner at the law office of Glenn & Johnson in Houston, Texas. Mr. Johnson served as the 32nd General President of the Alpha Phi Alpha fraternity and is the president and CEO of the MLK Memorial Foundation. Mr. Johnson spearheaded the Alpha Phi Alpha initiative to raise over $120 million for the design and erection of the MLK Memorial. Joining us later this evening will be the other formative co-chair, James D. Staten Jr., principal owner at Staten & Associates in Grenada, Florida. Mr. Staten is an executive coach and business consultant with more than 30 years of experience in corporate and government management. Mr. Staten also finds time to provide CFO support to the nonprofit Friends of the Historic American Beach in Florida on a pro bono basis. Harry Johnson, the mic is yours.
Thank you so much. Good evening, Ms. Lattimore. What a pleasure and honor it is for me to be with you tonight as we talk about this very important topic. Interestingly enough, I am pleased also to be the co-chair with James Staten for the Charles L. Franklin Male Associates. What is that? The Charles L. Franklin Associates is a men's membership wing of the National Council of Negro Women Incorporated, NCNW, founded, of course, in 1935 by Dr. Mary McLeod Bethune. It's a nonprofit organization with 32 national affiliates, 200 community-based sections, 81 campus-based sections, and an outreach to over 2 million women of African descent. The mission of NCNW is to lead, advocate, and empower Black women and their families and communities. The CLF Associates is named in honor of the late Dr. Charles L. Franklin Jr., an activist, leader, and advocate for family health, who was highly supportive of the National Council of Negro Women. That's where I am happy to be here tonight. My co-chair will join us later. Let's get into the topic. We have an interesting lead-in and topic to discuss tonight. Male breast cancer. All people, whether male or female, are born with breast cells. and tissues. Even though males do not develop milk-producing breasts, a man's breast cells and tissues can still develop cancer. Even so, male breast cancer is very rare. Less than 1% of all breast cancer cases develop in men, and only 1 in 1,000 men will ever be diagnosed with breast cancer. To talk to us tonight, we are so pleased to have an author, professor, lecturer, motivational speaker, music executive, artist manager, entrepreneur, fighter, and cancer survivor would be the words to sum up the life of Matthew Knowles. Dr. Knowles possesses an MBA in strategic planning and organizational culture, a PhD in business administration, and recently attended Harvard's professional development course in ethical leadership. In music, he has architected the careers of Destiny Childs, Beyonce, and Solange, just to name a few, and he has worked with such legends as Shaka Khan, OJ's, Earth, Wind, and Fire, and many others. Please welcome, for tonight's discussion, Matthew Knowles.
Thank you. Thank you, Mr. Johnson. And Ms. Lattimore, I have to first say shout out to the Deltas. I'm an Omega, so we're sisters and brothers. So thank you so much for having me. I like to just share my story. A year ago and 2 months, I was taking off my white t-shirts and noticed a dot of blood. And you know, I didn't think anything the first time. And the second day, I saw another drop of blood in the same area. And then the third day, and then I asked my wife, I said, you know, I keep seeing this drop of blood, and I'm thinking she's got some t-shirts or something. And she says, that's very interesting, because when I cleaned the sheets, there was drops of blood on your side of the bed. Well, I have to pause for a second and just give my background. In 1980, I transferred to the medical division of Xerox and sold Zero Radiography, which was the leading modality for breast cancer in the 80s. And so I knew one of the symptoms, and I don't use the word breast cancer, and let me share with you why. I just think it's the wrong word for men, and I believe in messaging and how can we help save lives, and if it means maybe a different messaging. So I use the word male chest cancer. I just think it's more appropriate, and I think it's what men can feel more comfortable with. But let me continue the story. So I immediately called my physician. We then, as we saw the video, the exact thing happened. Mammogram, ultrasound, biopsy, and surgery. For me, it was within a 17-day window. I'm fortunate, I'm grateful to have been stage 1A. Family history, yes. I had to go all the way back. I was asked to research. My grandmother's sister, as far as I could go, died of breast cancer. My mother's only sister and her 2 daughters also died of breast cancer. Also in my family, my sister-in-law just recently, 2 years ago, a year and a half, died of breast cancer in her 40s. And my mother-in-law is a survivor. But it's something very important here that I learned that I didn't know. It's called BRCA, BRCA, which stands for breast cancer, BRCA2 mutation, cause and effect. The effect was male chest cancer. The cause is I'm BRCA2 mutated. And it was really, really important all of you understand that it's genetics now in medicine. And this is a simple, you can call any company, just look it up online, that do the screening, and you just give a sample and you mail it back, a saliva sample. And then you get to know if you're at higher risk, because as a man with BRCA2 genetic mutation, I have a higher risk of prostate cancer, pancreatic cancer, melanoma, and male chest cancer. So there's a lot of men walking around thinking that the cause was prostate, when in fact it was male chest cancer. And they were BRCA2 mutated, which I unfortunately didn't see in the video because genetics we're just understanding. And so it's important, early detection is the key. When we look even at Black women, there's a 40 times greater mortality rate than white women. And it's about early detection and going to your doctor and knowing your family history and knowing your genetics, because you can also do the same thing for cancer screening genetically. You can do it for heart disease. And that's the important message that I want to make sure people understand the genetics of this all. Sorry, can't hear you. So, when we look at, telling my story, I've spoken to many men that are embarrassed. In 1980, it was a 1% men that could get male chest cancer. It's now 2020, and we're still saying 1%. And we all know that's ridiculous to think that there's been no change in a number. And that's because most men can't get over that word. And we need to maybe look at also our messaging for men. Mr. Johnson?
Great points. Let me just ask you a couple of questions, Mr. Knowles. And first of all, I heard about breast cancer in men from the late Senator Ed Brooke. In visiting with Ed Brooke, he was the first person ever mentioned breast cancer to me in a man. And then after that, I heard about Richard Roundtree and others who also obtained it. But you brought up a good point. Ed Brooke said that a lot of times men don't know after they get prostate or colon cancer that the ultimate or the first thing that happened was you actually had breast cancer. So that's your understanding as well?
That's absolutely my understanding that it could be, but this all goes back to if you get to simple screening of understanding your genetic makeup, then it tells you, no, you're not necessarily going to get it, but you're at higher risk, so you have to make a lifestyle change. I used to sell the equipment. I didn't know about BRCA. I'm the guy that goes to the doctor and routinely get checked. Had I known about genetics, trust me, I would have done that years ago. And so I want to focus on the genetic part of this because most people don't know. We're still doing it the old way.
So let me ask you a question as we talk about genetics. Not necessarily because your mother or father had colon or prostate or lung cancer, it's any type of cancers that could mutate and then turn into breast cancer. Is that not true or not?
That I don't. I don't profess to be a doctor. What I do know is that if you have mutations genetically, that you have a higher risk. And I do know if it's BRCA2 for male chest cancer, then you have a higher risk in those areas that I talked about, prostate, melanoma, and pancreatic. So I do know that. That is science and that is a fact. So why not just go and get a genetic test? And the important thing here, again, is early detection for men and women. And that's early detection for all diseases. It's a known fact. The earlier you find it, the better the results. The later, the results are not so good. I'm just grateful and blessed that I found this at its early stage. I didn't have to, fortunately, go through chemo. I had a mastectomy, and I take one pill a day, and I will for the next 4 years. It's a 5-year period that I have to take medication, but it's only one pill, and I'm very grateful and fortunate. And I love telling my story because we're telling and talking today things that can save somebody's life. and there's no greater importance.
Very, very interesting that you talked about your early symptoms that you had the blood. Were there any other symptoms other than the blood spots on your T-shirt and in the bed? Were there any other symptoms that you had?
Not at all. No, zero
No
symptoms.
pain,
No
no,
pain,
no lump, none of that.
no lump. But nipple discharge is a well-known symptom, the number one symptom for men. So I knew that. I knew that from 1980 to 1988 when I sold mammography equipment. Fortunately, I knew that. And fortunately, I did not hesitate like often we men do. I didn't hesitate to go to my physician, and I didn't hesitate to have the surgery.
Next question I have for you, you talked about genetic testing, that you would suggest that men and people get a genetic test. How often, what age group should they get this genetic test done?
Well, it's suggested that in your 30s, 40s is the time period to get genetic testing. The company that I did my genetic testing is called Invitae. So I just want to give information to those of you that are watching that you know, and also it's cancer screening as well as heart disease. And so it's very important that we follow the guidelines. There's guidelines for women. There's not those exact guidelines for men other than the genetic testing. The guidelines for men is once it happens, and we all know that you don't want to feel a lump. You don't want to have the discharge. You want to be proactive against that. I've made lifestyle changes. I've lost weight. I don't drink alcohol. I eat meat only once a week. Those are some of the lifestyle changes. Once you know that you have the genetic mutation, you make a lifestyle change. I get a mammogram every 6 months. The zero field of radiation, that's for me a myth, total myth. The radiation dosage in a mammogram is so minimal. So it's doing those type of things that I know for the rest of my life that I will be every 6 months getting a mammogram. What a simple thing to do to get a mammogram. Well, it takes an hour of my day, 2 hours of my day to save my life. You put it in perspective.
Well, one thing I'm gonna applaud you on is doing a lifestyle change, because again, I ended up with some medical stuff, and the doctor asked me how many hamburgers I ate a day, and I told a week, and I told you, said that's too much red meat for a man to be eating at any point in time. So I applaud you for that change, and I think most men ought to make a change as we get older in their intake of red meat, because I've heard someplace, I don't know, that red meat is one of the other causes of cancer in people in general.
Well, you look at all the history and look at the science. You look at diabetes, heart disease, cancer, and they talk about the risk factors. Obesity comes up in every last one of them. Even in coronavirus, obesity comes up again. And as a race, we are dieting, you know, we have to pay attention to it. And you're from Texas, you know, we have a history of being proud to say in the past, but that's not cool anymore. I'm here in California. People look at life differently. They have a different lifestyle. Health and wellness is a very important thing. In the Black community, we have to make health and wellness number one. You become a liability to your family when you're sick. No health, no wealth financially. We have to put this in the right perspective of what's number one and the most important.
I couldn't agree with you more. I think the older I get, the more I realize about health, and that you don't want to be walking around with a cane. You don't want somebody helping you in and out of the car. You want to have mobility and be able to get around. Let me ask you a couple other questions. Someone once told me that you ought to get a full body CT scan every year. What's your thoughts on that?
Well, Again, I have to give my history. I did 20 years in the medical profession, 16 of those diagnostic imaging. I sold MRI and CT scanners for 5 years. Breast MRI for women, incredible tool. I don't necessarily agree with a full body CT scan because, one is looking at soft tissue, and I don't want to get into the technology, but the technology is different. For me, if I get a headache, instead of an aspirin, I want to get an MRI because I know the value of that particular procedure and the diagnostic value of it.
Well, I'd like to point, I hope that the National Council of Negro Women and the Delta Research Foundation would get it out, that we should get an in vitae and get the genetic testing. I think that's very important. A couple other questions I have for you. Were you initially ashamed or fearful to share your diagnosis with others?
I wasn't ashamed to share, my diagnosis with others. No, that's a prayer I once saw on the back of a card. First thing I said, because regardless of man or woman, you say, why me? And that prayer was, pray not for a life free from trouble. Pray for triumph over trouble. For what you and I call adversity, God, the universe, whatever name, calls opportunity. So I asked myself, what was the opportunity for me to come with male chest cancer? And the opportunity was for me to share this story with other men and for me to share the importance of health and wellness to our community. So no, I was not ashamed and am not ashamed to tell my story because we're talking about saving lives. We're not talking about selling records. We're talking about saving lives. And yes, that's the reason why my messaging is different, male chest cancer, because it's a tremendous amount of embarrassment that a man has to open a door that says breast diagnostic clinic. That's not a word we use. Men walk around with no shirts on TV commercials with no shirts on. And out of respect to women, I just prefer not to use that wording and that messaging for men. And if it saves lives, why not? If it makes men more comfortable, why not?
Wonderful, thank you. What about, did you seek counseling at any point during the process, trying to figure out stuff?
I believe in mental health. I'm fortunate to have a Black therapist, a Black man for therapist, Ala Dallas. And even with this coronavirus, I consulted him. So yes, the answer is absolutely yes.
Yeah, I was listening to Michelle Obama's podcast, and she talked about what was going wrong with folks right now. She says, probably realize everybody's depressed and don't want to admit that you have some type of depression because you're in the house all day and going through that stuff. I applaud you on seeking out counseling and going through this. But how did you cope with your diagnosis? What did you do to cope with it on a daily basis after you heard about it?
Well, that was it. I have a great team. I believe in team. I've been on many types of teams in my life. And so I have a great physician that I've known for years now. My surgeon, incredible there in Houston at Methodist Hospital. My oncologist I actually talked to today at the University of Pennsylvania. So I have an incredible team, and I encourage everyone to have that team regardless. We need to have a team around us, and that includes the mental health. I want to quickly, in 1 minute, tell my therapist said in a moment of crises like we are in a coronavirus, the things that we are fearful of, they magnify times 25. My fear, and I was scared at the beginning of the coronavirus, and I'm still safe. I think safety first. But my fear was because I was frightful of dying from this cancer, and I had come to grips of that. And so I was just crazy cautious. I mean, to the point it wasn't healthy when we first understood this. So this mental, having that person that you can talk to. Others, it might be their pastor or another friend. Everyone's is different. You know, I don't try to put everyone in the same box as this. For me, what worked for me is having a Black man as my therapist that understands my perspective from a different set of lens than a female would.
Wow. Well, how has the overall experience affected your daily life? I know you had some changes with diet, but your daily life, how has this affected your daily life?
Well, you look at life different and you put energy in every moment. Uh, you don't procrastinate, and you have a sense of urgency once you've had this cancer of any type. Your life and your perspective on life and having that sense of urgency and making every day important and meaningful. That's how I look at life now in even a more assertive manner.
Wow. What do you feel, why do you feel that it is important to share your specific story to people like us who's listening in? Why is that important?
As I said again, I just want men not to feel like I don't want men to feel like they're in a unique situation that I don't want them to feel embarrassed or ashamed. I want them to know that others are going through the same thing. I've met many a man who's whispered in my ear, man, you know, I had that too. And I don't want them to have to feel they have to whisper. I want them to say, I'm a cancer survivor and I'm a male chest cancer survivor, and help others. That's what this is all about, helping others.
Tell us a little bit about the Men's Chest Cancer Campaign and how any of us get involved with that. Where do we go to find out more about it? And tell us about that campaign that you're heading up.
But what you're saying is a very important thing that I need help on. Uh, I have not tried to organize a campaign. And again, I need a team of people that can help organize and help me organize a campaign. And I hadn't really thought of it, Brother Johnson, till you just said it about a campaign. As of now, I'm just telling my story. And I don't tell it just in the month of October. I tell it every opportunity that I have.
Well, I think you ought to consider how we get that done and how we can help you get the word out. I think because of the omegas and the kappas and the alphas, and certainly through the deltas, everybody else, that we can help get that word out, create a website to talk about this. I just think that you ought to help and allow us to help you pull together the right resources to get the word out, because again, for too few many people know about this, know that it could affect them, their lives. And I think you got a lot to share to help mankind, to be honest with you. So I would ask that you consider that, and then maybe Ms. Lattimore can follow up with you and we can get together and talk about how we create that campaign.
I would absolutely love that. And thank you for, I hadn't even thought about that. So thank you. I would love that opportunity.
Yeah, I think it's important. Again, after I talked to Senator Ed Brooke years ago about it, and he was so adamant that we ought to tell this story. He wanted to tell his story about this breast cancer. And then when I heard about Richard Roundtree and Ernie Green and others that got it, it's like something ought to be done about it. I think that might be your calling to help us get the word out and call it a campaign. Of course, you believe that early detection saves lives, so you don't have to comment on that. But let me ask you another question. Do you feel that advances in medical research assisted you in your options and ultimate decisions regarding how you got treated?
Yeah, yes, it did. I Google a lot. I read a lot. I'm inquisitive. I'm a college professor. That's wise perspectives I like to hear. I'm actually next week. There's a Zoom call that's talking about the legality of BRCA, because it was only in 19 actually just 5 years ago that this BRCA testing was available to everyone because it was patented by a company that would give up the patent. So they had to go to the Supreme Court twice. So this is the kind of stuff people don't know, and how medicine is evolving to telemedicine. You don't necessarily in the future have to go in front of the doctor. You can do what we're doing now. Diagnostic imaging tools are changing and getting more sophisticated. I started out, there was 0.5 Tesla MRIs. Now there's 3.0 Tesla MRIs. I mean, science and technology is always evolving, and knowledge is evolving. And so it's really, this thing, this genetic, I can't speak. I love talking about it because most people just didn't know it and don't know it exists.
Wow. Well, we're almost out of time, but let me ask a couple of more questions. Based on this experience, what conversations have you had with your family about this particular disease?
I've spoken to all of my family members. I'm fortunate to have a niece that's a doctor. She's gathered the younger of my family, because some of them, when you go second, third, fourth cousins, as you get older, you don't know them. But this genetics, it's a family thing. It's a genetic thing in our family. And I learned a lot as I went through this process. I didn't know my father, 4 of his 5 brothers died of prostate cancer. I didn't know that. So these are the things, but also about knowing family history of diseases.
Interesting. The final piece, I'm just going to keep reiterating that I just really think we want to help you get the word out on this. But let's hear some final words from you as we come to the conclusion of this part of the program. Any final words from you on what we should be doing, or your advice to us on what can be done to help alleviate this particular cancer?
Well, I think, again, it just goes to having knowledge, and that's what you are doing. And it's about early detection and health and wellness, and going on an annual basis to your physician and getting all the medical blood work, all of it. It's that important to us. And as we get older, it becomes more important as we become older. So that's my takeaway. Normally it's that prayer, but I shared that earlier. Pray not for a life free from trouble, because trouble will happen in our lives and we will triumph. And it's through the many cancer survivors and telling their story that gives us all hope, but it also gives us information, which is key and critical. And I thank you for giving me this opportunity for me to tell my story, not his story, but my story.
Well, Mr. Knowles, on behalf of the Delta Research and Education Foundation, the CLF associates, and all who are listening in, we thank you so much for your insightful willingness to share what you've gone through. It takes courage for any man to get up and say, this is what happened to me. That did not happen to you. So we thank you. We applaud you. And I think sincerely that we're going to take you up on an offer to follow up and see how we can help you as we try to eradicate this terrible disease. Thank you so much, sir, for joining us tonight.
Thank you. Thank you for having me.
We're actually going to do a mammogram. A lot of men don't realize that they also need to be screened, particularly if they have family history, but they need to be screened as well. So they need to take breast cancer as critically important as it is for women.
Super tight right here, bear with me. Get my fat fingers out.
It's rare for a man to need a mammogram, but
That's
it
true.
does occur.
Yes, we do. I don't know, probably maybe 1 a month or something like that. They usually do present with a problem, whether it's lump or pain.
I'm Terrence Shirley, and I'm the administrator for the Cancer Institute and the Division of Radiation Oncology at the University of Mississippi Medical Center. We're at the Jackson Medical Mall, one of the outlying facilities for the university. Men should be screened if they find a lump, as a woman might find a lump, and also if there's a family history. We're going to go through the process up until the point of we would beam on with radiation. So we're not going to actually beam on, but We're actually going to do everything else. We're going to simulate everything else as if this was an actual mammogram.
Male breast cancer is very rare. It's less than 1% of total cancers diagnosed. If, 10 men show up, the chances of each one of them having breast cancer is very, very small to none. But that does not mean that it does not happen in men. It does. You have to be vigilant and do the right thing and show up to the breast center. When men feel a lump, it usually freaks them out even more than it freaks out women. Because women will find lumps all the time in their breasts. Men, if they find a lump, they're like, okay, I need to get this checked, which is the right thing to do. But all lumps, like I said, are not cancer. Most lumps in men are completely benign or just increased breast tissue in the breast, which in men is supposed to be dormant. It's not supposed to grow like women. So when it does start to grow in men, for whatever reason it may be, it causes a lump and tenderness. When women find a lump in their breast, they're like, well, there is no family history. This cannot be cancer. It's not true. Don't take it lightly, because 75% of the breast cancer comes in women or happens in women who do not have any family history of breast cancer. Early detection is important to maximize your chance for a cure. Treatment is not as hard, long, or expensive as it would be if it was more advanced.
I think you did great. Most of our men that come in are real nervous and unsure, and most of them work with you pretty well because they're kind of like, okay, I don't want to mess up.
I'm glad I did this. It gives me a better appreciation for what we have over here and gives me a real appreciation for the type of equipment and type of staff that we have. And then when I get a request for this type of equipment, I now know what we're actually buying, and it really makes a difference to know.
Well, let us continue on Let's continue on with our conversation tonight. How pleased we are to have with us Mr. Terrence Shirley. He has extensive experience as director of the federally supported community health centers and state-level public health services, as well as hospital and ambulatory clinical operation. He holds a BS degree, in political science and government from the University of Southern Mississippi, and a master's of public health, hospital and health care facilities, administrative and management from the University of Tennessee, Knoxville. Currently, Mr. Shirley is the administrator of the UMMC Cancer Institute. His father, Aaron Shirley, worked to transform the former shopping center into a medical home for many in Jackson, Mississippi. It is now home to multiple medical offices, including the adult outpatient clinics for the UMMC's Cancer Institute. Please welcome Mr. Terrence Shirley. Mr. Shirley.
Oh, thank you. It is a pleasure to be here. Glad to have the company of such esteemed people.
Well, we want to hear your story. We want to hear a little bit about the UMMC Cancer Center and Research Institute. Tell us a little bit about that, what it stands for, what it means, and what it's doing.
The University of Mississippi Medical Center was established in 1955, and it's the only academic institution in the state, as well as the only level 1 trauma center. Established in 2004 was Cancer Center and Research Institute, which we're talking about tonight. That's been funded by the tobacco settlement from the state of Mississippi. So we receive tobacco funds for our cancer research in the state of Mississippi. We currently get between $4.25 to $5 million per year from the state. And to date, we've had roughly $55 million in funding from the state in that resource. Currently have 80 clinical trials in activity. We have roughly 27 grants going on. We provide services of basic science research in community. We provide clinical science research, translational research as well. So that's the one that's really key to us, where we're literally taking the science from the laboratory to clinical practice. We have a hospital floor that's solely dedicated for our clinical trial activities. And as you mentioned in the bio, our clinics are located at the Jackson Medical Mall, for which my father actually started, renovating a 1 million square foot vacated mall. And now all of our Cancer Institute clinics are located there, in addition to our secondary and specialty care clinics. And we do have, and I'm glad Brother Knowles talked about geneticists, we do have geneticists on site that we use for our cancer screenings as well.
Interesting. Thank you so much. Let me ask you a couple of questions. What is the historical and generation connection between you and the facility? I think I heard you say your father, but anything other generational connections between you and the facility?
Well, actually, we have a 55-year connection. My father was the first learner of any color to be accepted into the medical center training program. So he did his pediatric training in the University of Mississippi Medical Center. Later on, he established the Jackson Hines Comprehensive Health Center, and I talk about him because he forged so many doors and relationships with the university, which ultimately got me to come back from Tampa to actually work at UMC. So he established a community health center, Jackson Hines Comprehensive Health Center, where that center serves the medically underserved patients in the Jackson and surrounding metropolitan area. By him being at the Jackson Hines, he established formal relationships with UMC, where he could refer the medically uninsured, and UMC would actually see them and continue the care that was detected at Jackson Hines. He also then founded the mall, for which we've talked about. And the beauty of the mall is that UMC, Tougaloo College, Jackson State University, all are partnerships in that particular relationship. So they have vested interest in what goes on at the mall. And we see over 300,000 or 400,000 patient visits at the medical mall between the disciplines that are physically located there. And the mall is not solely in Jackson. It serves people across the state. So it's actually the medical home for a lot of underserved individuals in the rural communities.
Interesting. Thank you so much. I'm gonna have one follow-up question, but then my co-host, my co-chair is gonna join us and he'll follow up questions. But you talked about you got $55 million from the state. Did you get and receive any federal dollars for the program?
Our federal dollars come from grants that our researchers apply for. And so we have NIH funding, we have other industrial fundings as well. So we don't have direct funding as relates, not to that tune of dollars, but we do have grants from our researchers.
Okay, with that, I'm gonna introduce Mr. James D. Staton and let him take over the questioning.
Yes, and thank you. And thank you, Mr. Shirley, for joining us. This is an important conversation. And I'm gonna tell you, men of courage, that's what I'm gonna say. You are courageous people, men, you and Dr. Knowles, to come out and talk about a subject of cancer and men and women. I applaud women. That's why they're living longer. They deal with this. And we know about women and cancer, but for men, this is in education. Here's my question. How important is education, research, and testing in the Black community?
Well, take COVID-19, and that gives you the answer that you have to have. That's a classic example of what goes on in our community. We are disproportionately higher incidence of disease, disproportionately higher with deaths among Blacks and minorities. And we realize that due to COVID-19 and other chronic diseases, we're truly lacking in education, testing, and research in the African American and the minority community. And it's been well documented that health disparities and social disparities in the Black communities, both rural and urban, are significantly greater than that of whites. If we don't aggressively work to enhance education, research, and testing in the Black community, we'll never close that gap of the health disparity.
Mr. Shirley, thank you. This is so true. But let me just do a follow-up. How can we seriously get Black men to get rid of these phobias?
We have to, I think about the Tuskegee experiment still looms large. And we have to really work and educate not only the Black community and the Black males, but we have to educate the providers that are actually requesting people to go into clinical trials. They are culturally insensitive to what we do and how we are in our community. We have to expose minorities to research at a very early age so they understand what's going on. We have to improve our communication and outreach to HBCUs across the country. We have to actively recruit students, minority students, into the research field. I can count them on one hand, the number of African-American researchers that we have at the University of Mississippi Medical Center. And we've had a program during the summers of having students from Tougaloo College to actually come and do internships at our institution just to open the door so they get some knowledge and some interest into the research aspects of what's going on. And we truly, truly have to require intensive cultural sensitivity training in all aspects of research.
All right, thank you. Some people believe that exposure to radiation during mammogram actually causes cancer. How can we address these types of myths that are often present in minority communities?
That goes back to reaching out to the community. We literally have to be embedded in the community, and we have to be willing to take a grassroots approach to how we address the medical issues. People listen to it and they get fear. We have I won't go political. We have misinformation out there all the time. And we have to make sure that what we do gets down to their level. That's one of the reasons why I wanted to do that video, was when they see a Black man go through the mammogram process, they see it differently than when they see it on a TV commercial and have no connection to the person that's doing it. So we have to literally have people that understand us to actually come and have those communications with us and teach us and address those questions, and have spent time with us in the exam room, spend time with us during the consultation process of explaining what the risks are and to help dispel those myths.
Well, that leads to the next question. Thank you. We watched the video. Yes, very, very impressive. And that's an educational tool. Tell us about your personal experience with getting that mammogram. What were your thoughts?
When I left out, I was real comfortable, actually, you know, again, because I'm actually in the area, and those departments reported to me, so I was familiar with it. So I went in with an advantage, but I have never gone through the process of having that machine press on my breast. And I can only imagine how a person felt, how a woman feels, particularly with dense breasts, that the pain that they go through. So, but it was a rewarding experience because I understood it. I understood what was going on, and I understood the value of it. And I come back and say, any man that has a significant other female that has gone and had their mammogram, take them out to dinner, because it hurts. But you got to also get over that process as well. But my experience was good. And I haven't looked at the video in a year or so. And when I looked out there today, actually, it had 31,000 views. That spoke volumes. I would never have thought that would have reached that many people, that 31,000 people actually looked at that. So it touched someone. And I hope that it has saved several people's lives in the process.
Well, you touched on the women. So how has it changed your perspective of what women are going through?
Oh, it has opened a new door of respect. I truly understand now when a person talks about the fear or the discomfort, or I don't want to go. I understand now basically what they're going through, because it is nerve-wracking if you have a suspicious lump. I didn't, so I went in it from not having the lump, but I can only imagine what a woman goes through, and I really applaud them for what they do, and I applaud those support systems that they have.
What could women do to help the men in their families? How can the women support the men in their families early on, not when you dealing with the situation, when it's at hand, but what support could women give their men, boys?
Talk to them early. Get them to understand early, at an early age. Don't let it be when it has happened. Don't let it be when it is a situation of, oh, I'm scared because I feel something. They need to have those conversations, particularly as Brother Knowles talked about being predisposed because of genetics, that if they are predisposed, then they definitely need to have those conversations early. They need to go and get it done, have the conversations with the counselor, and they literally just have to support them as they would want them to be supported themselves.
Right. Well, this is my final question, and I don't know whether my co-chair has a question, and I'll open up to you for any final thoughts. But I want to include in my question, what was the emotion like, and your spiritual connection, and any other final thoughts that you would like to share?
When the spiritual thought was, we talk about only 1% or less than 1% of men have breast cancer. So I went and pulled the data on Mississippi. And Mississippi, Black man, from the years 2013 to 2017, we had 44 cases that were diagnosed. Of those 44 cases, 9 people died. That's 20%. That's a high percentage for that number. You think about that. What other diseases other than pancreatic cancer, we won't just do numbers per se, but you think about that's a very high percentage for that number. And it was, now that I see what this can do to you, and now that I see the numbers of the people in Mississippi, it really just drove me to say, you know, we have to get out there and we have to make sure that people understand that, myths aside, gender aside, this is something that we have to do, and we have to do everything that we can promote this type of, and I'll use Brother No's campaign. And
Yes.
the final thought is that, you know, our family grew up in this environment. Our family grew up in the healthcare arena and in the arena of helping those less fortunate. So my siblings and I established a foundation in our parents' name, the Doctors Aaron and Ollie Shirley Foundation, and in conjunction with the Institute for Minority Health, that we are going around in the communities across Mississippi and trying to effectuate and improve health outcomes. So Brother Knows, and I call him Brother Knows because I'm an Omega as well. So Brother Knows, when you start and kick off your campaign, the Shirley Foundation is ready to step in and help you.
Thank you so much. And I believe the 06, the Alphas will be right there with you.
We want you there. We have a Panhellenic Council.
Yes, absolutely. Thank you so much. Thank you for your time and for your courageous, the work that you are doing to speak truth. You are a testament and a testimony. And I certainly hope that our viewers are listening and will help pass this on and join your campaign to educate our families, to save lives.
Absolutely.
That's what it's all about, saving lives, saving lives. And thank you. And I thank Delta for bringing this, for the group putting this together.
Thank you,
Brother Harris. Yes, glad you're here. You need to unmute. Can't hear you. He's still muted. Unmute. Unmute. Oh, your sister.
I apologize. Again, I want to say thank you as well to the Delta Research and Education Foundation. Thank you, Ms. Pat, for pulling all this together. Thank you, Mr. Knowles and Mr. Shirley for joining us. One thing I want to say that we all are in this together. So I talked about the Charles L. Franklin Associate Institute earlier. Let me talk about how you become a member. We want you to say that men can join via the NCNW website at ncnw.org or through their local section or college. The membership is only $50 a year. We really are there to support NCNW, but we accept men. We just want men to come together so we can talk about these issues and others as we talk about the future of men, our health, and how we support National Council of Negro Women. And with that, I turn it back over to Ms. Pat and or to Dr. Maria Dixon.
We're going to give Dr. Maria Dixon the mic. She's going to close us out.
Thank you. Thank you.
Good
afternoon.
Good afternoon, everyone. I am Dr. Maria Dixon, and I serve as the engagement coordinator for the DREF Research Matters for All of Us initiative. On behalf of the Delta Research and Educational Foundation, we would like to thank our panelists. We have just a few questions from our audience. So for Mr. Knowles, have you experienced any side effects from the mastectomy or from the 1 pill a day that you've been prescribed?
You know, I have from the medication. There's a couple of side effects, but when I look at what the benefits are, they greatly outweigh the minimal side effects that I've had.
Awesome. So you mentioned that your wife was supportive during your diagnosis and your treatment. So what message would you like to share to spouses out there and their loved ones to encourage support in genetic testing?
Well, I want to just reinforce again, my wife lost her only sister to breast cancer, and her mother is a breast cancer survivor. So she had some understanding But I encourage all women to support their spouses, because as men, we have this hard head that it won't be us, and we'll get to the doctor when we can. And what I heard earlier suggested to me one question to ask the audience. Who is your physician? And if you can't name a physician, you got a problem.
I absolutely agree. We have a question for Mr. Shirley. What type of community resources or support does your facility offer?
We have nurse navigators. We are very connected with the American Cancer Society. We have social workers. We provide, for those that can't afford it, we have grant opportunities where we provide transportation to and from their doctor's appointments. There's housing available for those that live outside of a certain geographical area that they can stay at the Hope Lodge, or we put them up in certain hotels depending upon the length of time for the course of their treatments. Those sort of things.
Okay, that is very helpful, especially as a native of Jackson, Mississippi. It's very exciting to have someone like you on our call tonight. And again, thank you for joining us. And so on behalf of the Delta Research and Educational Foundation, we would like to thank Dr. Matthew Knowles for sharing his story about male chest cancer, Mr. Terrence Shirley for his informative perspective, as well as our moderators, Mr. Johnson and Mr. Staten from CLFA for moderating this amazing and very informative event. So if you guys haven't done so already, please scan the QR code or click on the bit.ly link to complete our engagement exit survey. Your responses are very helpful for planning future events. The code also provides access to our social media platforms, as well as our vanity link, to learn more about the All of Us Research Program and the DREF Research Matters for All of Us initiative. So according to data reported by the American Cancer Society, breast cancer is widely known as a woman's disease, but it still affects over 2,600 men a year, killing about 500 annually. This data also states that much like Black women, Black men are at a higher risk than white men. Studies also report that Black men are 76% more likely to die from breast cancer than white men. Again, generally because screenings are overlooked. So in addition to my role as the engagement coordinator, I am also an inflammatory breast cancer, also known as IBC, research scientist. This type of breast cancer is disproportionately affecting African-American women, young African-American women. And so during my experience in researching IBC, I have experienced numerous and ongoing challenges associated with the lack of African-American patient samples. And this leads to the inability to conduct experiments to better understand why there's an increased mortality in African-Americans than other races. This is exactly why research is so important. So the All of Us Research Program is inviting 1 million people across the United States to help build one of the most diverse databases in history. We welcome participants from all backgrounds. The All of Us Research Program provides genetic testing, which was mentioned by Dr. Knowles this afternoon. And this will provide more information about you and your family and your history. Researchers will use the data to learn more about our biology, our lifestyles, and our environment, and how our environment affects our health. This could help develop better treatments and ways to prevent different diseases. We invite you to visit our website at www.joinallofus.com/DREF to learn more about the All of Us Research Program and the DREF Research Matters for All of Us initiative. As we close this evening, we invite you to hear some words from the possibilities of research and precision medicine from a very familiar voice. Again, thank you for joining us.
Something called precision medicine, in some cases people call it personalized medicine, gives us one of the greatest opportunities for new medical breakthroughs that we have ever seen. Doctors have always recognized that every patient is unique. And doctors have always tried to tailor their treatments as best they can to individuals. You can match a blood transfusion to a blood type. That was an important discovery. What if matching a cancer cure to our genetic code was just as easy, just as standard? What if figuring out the right dose of medicine was as simple as taking our temperature? And that's the promise of precision medicine, delivering the right treatments at the right time, every time, to the right person. And for a small but growing number of patients, that future is already here. 8 out of 10 people with one type of leukemia saw white blood cell counts return to normal with a new drug targeting a specific gene. Genetic testing for HIV patients helps doctors determine who will be helped by a new antiviral drug and who will experience harmful side effects. And advances in technology means these breakthroughs could be just the beginning. The year Dr. Collins helped sequence the first human genome, it cost about $100 million. And today it costs less than $2,000. Wearable electronics make it easier than ever to record vital signs from your blood sugar to your heart rate. Electronic medical records let doctors and researchers across the country collaborate more closely than ever before, and more powerful computers help us analyze data faster than ever before. So if we combine all these emerging technologies, if we focus them and make sure that the connections are made, then the possibility of discovering new cures, the possibility of applying medicines more efficiently and more effectively so that the success rates are higher, so that there's less waste in the system, which then means more resources to help more people, the possibilities are boundless. So the time's right to unleash a new wave of advances in this area in precision medicine, just like we did with genetics 25 years ago.